Hi, I'm Dr. Julie Steiner. Let's talk about amblyopia for kids. A lot of times we talk about how it's never too late to treat amblyopia for adults, but tonight I want to kind of talk to you about it's never too late. It's never not possible to treat amblyopia for kids because we don't seem to cover that one quite as much. Now, before I do that, let me just talk to you about how you can connect with us. If you happen to be local, give us a call at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can either schedule a consultation with me, which there's a button you can click, or you can fill out a questionnaire from that page. Either one of them will eventually get over to us discussing things about how we can help you. Now, we talk about amblyopia, and you know I am a fan of my Syntonics goggles, and we discuss these all the time. But with amblyopia with kids, there's really, unless there's some sort of disease process going on or some unusual circumstance, then it's typical that you should expect that you should be able to correct the amblyopia down to 20/20 or 20/25. Now again, there are a few caveats to that, or a few exceptions, but for the most part, about 98 to 99% of the time, you should be able to correct things fully for kids. Now, a lot of times I hear, well, they're past that golden age of 7. I heard that if it's past 7, you just can't do it. That's not true at all. You know I talk about this with adults, so if that's the case, then we know that we can work with kids too. So there's no, magical age that you can't, like, oh, it's just too late. That's not the case, okay? So what we do is we train the brain electrically to process information better. So we use photosyntonics or syntonics goggles. We use something called TBI lights that stimulate the eyes, okay, with a light that flashes. We do patching. We do quite a few things all at the same time to stimulate the brain to be able to see better with the amblyopic eye. In some cases, remember that amblyopic eye, or eye that doesn't see well, it's also sometimes called a lazy eye, okay, because it doesn't see well. Now, in some cases, it can actually be both eyes, so it might be bilateral, in which case we want to stimulate both eyes to see better with the brain. So again, lots of things that we can do, electrically stimulating the brain, and then we physically kind of come back alongside of things and do motor activities where we would patch and track, patch and do small detailed work. There's many things that can be done. You also want to realize that you probably are going to need to alter lens prescriptions. Kind of depends on what you come in with, but you might go through more than, one set of lens prescriptions if we're trying to maybe decrease a lens prescription as well as get your child to be non-amblyopic. Now in our office, we try to be kind of judicious about this. We don't try to change your lenses 6 or 7 times. We try to maybe only do it once or twice during the course of treatment so that you're not out all the expense of the extra filters being changed or glasses being changed out. Other things in addition to like the electrical stimulation and the motor stimulation is that you do have to do some specific types of maybe kind of motor types of activities that are at distance with patching that's really small detailed in order to get the brain to recognize smaller and smaller things. You also want to be able to look at a chart. We call these the Snellen eye chart, and you can usually download one online. There are some that will work perfectly fine that you can measure your eyesight with, your child's eyesight with from time to time, usually maybe something like weekly. And what you want to do is you want to encourage them to read the line below where they feel comfortable at. So even if they miss like 2 or 3 or even 4, if they're kind of close, like maybe they see a C and say an O and it's a D, give that to them. We kind of say that's a gimme. Let them have that, because similarities will mean that later on the brain will process that more distinctly. It helps you push them farther down the chart, and then you'll be surprised. Our rule of thumb as an office is that we'd like to see 1 line of improvement per every 4 weeks, depending on how much improvement we need to make or how serious of an amblyopia case it is, because maybe there are other factors like strabismus or an eye turn. So you have to bear in mind that there's a lot of things that have to be worked on. We need to start getting the brain to see better with the amblyopic eye, as best as what it can. Then we need to make sure that each eye individually can function really, really well. And then we want to put a system together, make sure the brain doesn't shut down that eye still. Maybe we need to also reduce lens prescriptions. And then the last thing is that we need to develop depth perception. So there's many, many steps involved in treating amblyopia. Anyway, remember, kids, we can do it for them just the same as we can do it with adults. There's not an age barrier or factor there as far as who can be helped. Now, if you want to reach out to us, please feel free. Obviously, if you're local to us, give us a call at 618-288-1489. If you're not local, then go to our website at visionforlifeworks.com and either click a consultation or fill out a questionnaire for us. If you like the video, we'd love it if you hit the like button, subscribe if you've not done so, to subscribe to our YouTube channel already. We're also on Rumble, so you can hop over there and check us out on Rumble. And the other thing I would say is, obviously, if you feel like this could be beneficial to someone, maybe you know that your next door neighbor's kid is amblyopic, then pass the video on to someone else who could benefit from it. Thank you.